Good afternoon, and welcome to the PolicyMap webinar, Health Equity Through Data and Mapping. My name is Kristen Crandall, and I'm a member of the PolicyMap team, and I'm thrilled to be hosting this webinar today. For anyone who might not be familiar, PolicyMap is a national online mapping service that provides maps and data visualization tools for tens of thousands of indicators related to health, housing, demographics, and more. It's used by a wide range of users in government, healthcare, academia, philanthropy, and throughout the nonprofit and commercial sectors. And as we've seen an increase in users looking towards PolicyMap to help further their health equity work, we've looked to provide more resources on the topic, such as this webinar today. Following the webinar, we'd be happy to provide free trial access to PolicyMap for anyone who might be interested. So why use data and mapping for health equity purposes? We can probably all agree that where you live is deeply important to your health, and that across the nation, gaps in health are large, persistent, and increasing. As stated on the Robert Wood Johnson Foundation's website, health equity means everyone has a fair and just opportunity to be healthier, while also acknowledging that it's very difficult to be healthy without access to good jobs, homes, and schools. Taking a comprehensive approach to understanding health disparities requires data on all of these topics, which is where tools like PolicyMap can be extraordinarily helpful. Today, we will walk through some examples of how data and mapping are used to advance health equity. So before we get started, I just need to cover some of the usual housekeeping items. We're hoping to get lots of great questions throughout the presentation. While you are all currently in listen-only mode, we welcome you to type in your questions to the GoToWebinar control panel, and we'll address them at the end of the webinar. Also, the webinar will be recorded, and both the recording and slides will be sent out to all the registrants over the next few days. So here's a quick agenda for today's session. First, my esteemed colleague, Eliza Wallace, will start by giving an overview of the health equity related data that's available in PolicyMap. Then I will take the reins and walk through some example scenarios of how these data can be used in actionable ways by various types of stakeholders. We'll conclude with plenty of time for questions and answers. Again, please do type in questions throughout the presentation. So now to kick things off, I'm pleased to turn it over to my colleague from PolicyMap's data team, Eliza Wallace, who'll provide an overview of some of the data related to health disparities that's available in PolicyMap.
Okay, thank you, Kristen. I am happy to join you this afternoon. My name is Eliza Wallace. I am the data development lead here at PolicyMap. I'm just going to take some time to give you an overview of some of the data that we have available that relates to health. We have a number of different data sets available. I want to start by talking about the life expectancy data set, which is a new set of data available from published by the CDC. The CDC, this is a result of a many-year-long study that created a neighborhood level, so census tract level estimate nationwide of how long a person would be expected to live based on where they were born. So as you can imagine, this includes the results of all sorts of different health impacts. It can it really encapsulates sort of the overall health of the neighborhood. So that's one that's really useful as really an overall indicator of health in an area. So it includes not just disease, but things like death because of opioid addiction, things that you hear about with that. It includes any other sort of cancer, any kinds of mortality from those kinds of events. I'd like to move on to some of the social determinants of health, which is a big topic, a big part of why we're here in this webinar this afternoon. We have just loaded again recently a social vulnerability index from the CDC. This is one that is a multi-part indicator. There are 4 different topics within it. A multi-part indicator that has to do with how vulnerable a particular neighborhood would be given some kind of disaster or weather event, things like that. So for example, we know that high heat index, heat is associated with high mortality rates. There are certain populations that are more vulnerable to death or to hospitalizations when the heat index is very high. So this is an index that can help target some of those areas to eventually move towards some interventions such as cooling centers or things like that. Same thing with hurricanes, fires, any kind of major disaster event like that. We also have a number of data sets that have to do with vulnerability and poor health outcomes due to problems with housing. So we have some homeless data from HUD, and that includes information on sheltered and unsheltered homeless, so particularly vulnerable groups. We have information on home ownership rates by age and race and ethnicity from HUD and from the census. We have information on places where people are struggling to cover their rent based on their incomes. So that's renter affordability, owner affordability, and what's known as housing cost burden. So areas where people may have to make tough choices when they are faced with, let's say, a disaster or a loss of a job, things like that. Some of those choices may have to do with whether they can pay their rent, whether they can get medicine. So we have data that speaks to that, as does income and poverty. These, as you know, are all sort of related. So groups of people that may have poor health outcomes due to socioeconomic factors. We have information on the computer and internet access information that we have newly available from the American Community Survey. This is a really interesting one because it can really point the way towards strategies for reaching the groups of people that can be identified through these other data sets. So when there is a target area that, say, there's a neighborhood that has high social vulnerability or high homelessness rates, or high poverty rates, trying to figure out how to actually reach those people. So, in terms of social vulnerability, if you want to help people know what to do during and after a disaster, is this a neighborhood where everyone has internet access, right? Can you just post some relevant data in a PDF on a website? Are people more likely to be able to access the internet through their smartphone rather than a computer? Or is it an area with poor internet access and low computer ownership? Is it an area where a print campaign may be more beneficial? So we have data on PolicyMap that can help you not only identify areas where health disparities likely exist, but also create strategies for how to target those areas with information. And here are just a few more examples. So in addition to social determinants of health, we do have some information on on poor health outcomes themselves. So chronic rates of chronic disease and cancer incidence, for example. We have a number of different chronic conditions indicators that range from diabetes to high blood pressure to high cholesterol, many of which are conditions that we know are related very much to demographic factors and are disproportionate in certain populations because of race or ethnicity, and in certain geographic areas of the United States. So we have data that speaks to that, that we actually developed in-house at PolicyMap using the CDC's BRFSS survey response. We have used that survey, national survey, to create small area estimates of some of the incidents of chronic conditions. So you can actually, on PolicyMap, you can look at the neighborhood level to see what areas most likely have are more likely to suffer from high blood pressure, high cholesterol, and these kinds of chronic conditions that can really impact people's quality of life. We have information on environmental hazards as well, so not just who is vulnerable to disasters, but where these kinds of disasters are likely to occur. We have information on contaminated sites, such as brownfields and Superfund locations from the EPA. So what areas are residents more likely to be exposed to contaminants and all of the health problems that can occur because of those contaminants, particularly in times of flooding or fire, or when those contaminants can sort of be released into the neighborhood. And finally, we have a number of indicators relating to healthy food access. So we have point level data on grocery retail locations and farmers markets from the USDA and from TD Links. And we have, so that can help you see where areas are underserved by healthy food options. Our grocery retail location also has filters that help you see what areas are served primarily by, let's say, dollar stores or other food retail locations that we know don't generally provide fresh food options. And this is information that feeds into other data sets that we have, for example, the limited supermarket access areas from the reinvestment fund, which allow them to help make investments in neighborhoods that are in areas that don't have good access to full service supermarkets. The limited supermarket access areas, I believe Kristen is going to show an example later on that illustrates that. But basically, it is a measure that shows you how accessible full service supermarkets are in given neighborhoods, particularly in urban areas. So that's just an overview. Definitely take some time to explore PolicyMap, and you'll see the range of data sets that can be easily turned on and off and easily shown in conjunction with one another. Thank you, Kristen.
Thank you, Eliza. That was super helpful. And I also just wanted to point out that nearly all of the data that Eliza just mentioned, as well as the other data in PolicyMap, is really easy to download. So for many of you, you might be interested in just extracting the data to use in other applications, and that's definitely a typical use of a way to get the data. So now it's time to bring some of this data to life by examining how it can be used in PolicyMap. So we'll go ahead and take a look at a few case studies of how various types of stakeholders use such data for day-to-day tasks. So to do that, we'll leave the PowerPoint here and go to PolicyMap. So if you've never seen it before, this is PolicyMap, www.policymap.com. And the first scenario, we'll go to the presentation again, that we want to consider is related to healthy food access and nutrition. So let's suppose that you're a state or local public health department and you're looking to identify areas with limited access to healthy food, as well as understand the characteristics of the community and assess what type of intervention is appropriate and sustainable. So with that scenario in mind, we'll go to PolicyMap. And let's suppose that you're interested in the area by Garfield Park in Chicago. So you can either type in the city or a zip code or a specific address to be taken to that location. So once you're zoomed into the right place, you'll find all the related data related to healthy food access in our health menu here. You'll see this food access section. So you'll see that in addition to the USDA food access data right here. We also have the reinvestment funds, limited supermarket access limited supermarket access analysis data, which Eliza was just talking about. So if we go ahead and put this on the map, you'll see that now we're able to see here any of the purple areas are considered limited supermarket access areas, meaning they have limited access to supermarkets, and any yellow areas are not considered an LSA. And as with all the data in PolicyMap, you just click on the title to get more information. So this paragraph right here explains a little bit more about about the analysis and kind of any caveats that we think that you should know, and gives a little bit more guidance about the data. And for those of you who are really want to know all of the details about the methodology that's employed with this particular analysis, you can always click through to our data directory. And you'll see here, this takes us to a much more robust explanation of what this analysis, how it was done, and also gives you some more guidance on how you would use it. So that's a resource. We try to be very transparent with documentation so that it's really clear which data we have in here and how you should use it. So besides getting a sense in the Garfield Park area of which block groups are limited supermarket access areas, we can also put grocery retail locations on the map to give us a clearer picture of exactly which grocery retail options are currently available. So when I go to the health menu, I'm able to add this point level data. So now you're able to see that all of the orange squares on the map are different grocery retail options in the area. And when I click on one, I'm able to see information about it. So here is an Aldi food store full service market. And with most of the point data, you'll see that there are filter options available. So if I go here to grocery retail type, I'm able to color code in a way that helps me see visually which types of stores are in which locations. So when I'm looking here around Garfield Park, I can see that there is a dollar store, a black square right here. And then I can see there's what looks like a superette over in the corner, and that there isn't much else in this area, hence why it's a limited supermarket access area. You can also get a clear, more robust picture of healthy food options in the area by adding farmers markets. So if I go back to the health menu, I'm able to add farmers markets. And now I can see that there appears to be a farmers market just north of Garfield Park. So I can click on it to get more information about it. I can see they do not accept WIC or SNAP. So that provides a kind of clearer picture of which healthy food options or potentially not healthy food options currently exist in the area. So now that we have this information, how might we get a picture of the characteristics of this community? So to do that, I'll create a target area, which in PolicyMap language, we refer to as a custom region. So I do that below the map. Here it says create. I'll go ahead and draw my target area that I've decided to focus on. And I can give it a name. So I'll call it the Garfield Park target area. And now I can save this region that I've just created, or this target area. And from here, I'm able to do a few things. When I click on this icon, I can query a downloadable list of the current grocery retail options that exist in my area of focus. See, here's the download button. And I'm also able to get a community profile report, which this is probably the easiest way in PolicyMap to be able to get a kind of robust, comprehensive picture of the characteristics of a community. So here's the community profile report for our target area by Garfield Park. And you'll see it gives an overview of population trends. We can see that in this area, the population has increased about 5% since 2000, as opposed to a 3% decline in the Cook County. gives us an overview of the racial and ethnic makeup of the area. So you can see that around 88% of the population is African American, much higher than for the state. And you can see the rest of the racial and ethnic makeup. In terms of age distribution, the population is extremely young, with nearly 35% of the population being under the age of 18. So a very young population. There's households by income level. So in this particular target area, over half of the households earn less than $25,000. And then you can see the rest of the breakdown as well. We can see an overview of the family and household types. And here we have an overview of the housing stock in the area. So we can see around nearly half of the housing stock is in small apartment buildings. And then here you can see the rest of the makeup. Home ownership is around 20%, so around 1/5 of households own their homes, so very low home ownership. And then there's a section showing commercial and residential vacancy that we update on a quarterly basis. And then you'll see some data around employment and employment by industry. So we get a sense that in this particular target area, the workforce is very overrepresented in healthcare and social assistance. And then there's some data around crime as well. So you can see this community profile report is meant to pull together some kind of key data to show you the characteristics of a community. You can also print and save these reports as well. So as we go back to the map, I just wanted to point out some other data related to the LSA study that we're looking at. So beyond the kind of yes or no designation, either limited supermarket access area or not a limited supermarket access area, there are also other indicators that can help deepen the analysis. You'll see that there's also a low access score, which helps provide a sense on a numeric scale of how severe the need is in a given block group. You can also look at grocery retail demand, supply, and leakage, which will help quantify the type of grocery retail establishment that can be supported in a given area. So while some areas might be able to support a full-scale supermarket, the appropriate intervention in another area might be smaller, such as something like seeking to expand healthy food options in existing corner stores or something like that. So that's the first scenario I wanted to look at. Now I'll just go back to the presentation. And I just wanted to say one more time that we welcome any questions, so please feel free to type in any questions. We've had a few come in, but please continue to type them in throughout, and we'll get to them at the end. So now let's move on to a second scenario where we'll seek to identify vulnerable populations. So in this example, let's suppose that you're a county government in Georgia looking to create an equity task force to achieve the goal of decreasing health disparities, focused primarily on the disproportionate prevalence of adverse childhood experiences across communities of color. So the project uses a strategy of building community collaborations across sectors to set and reach equity goals for the community. So with that in mind, we'll go back to PolicyMap. And I will just remove the data from the previous example. And for this example, we'll go ahead and zoom to Atlanta. So as a first variable, we could identify communities of color by putting different race and ethnicity data on the map, or we could look at child poverty or any one of the indicators that are in these menus individually, social vulnerability, et cetera. But this particular example is also a great time to use PolicyMap's 3-layer maps feature, which is the part of the platform that allows you to identify areas that meet multiple criteria. So in this case, I'm going to go here to 3-layer maps. And as a first variable to identify communities of color, I'll put the non-white population on the map, which is here under demographics. And you'll see when I add that first variable that the whole map is purple because it's showing selecting the default range of 0 to 100% of the population. But then as I change the numbers in this box right here, I'm able to select the specific criteria that is going to be helpful for me. So in this case, now all the purple areas on the map are showing areas that where more than 60% or more of the population is a race other than white. And this is from the Census American Community Survey. So then we can add a second variable. So we'll go ahead and add the percent of people under the age of 5 living in poverty, which we'll find here under incomes and spending. You'll see the different age breakdowns. And again, when I add the second layer, you didn't see any change in the purple that's on the map because the default range of 0 to 100% is selected. But then again, I can just edit my ranges here to set a different threshold. So now we see that all the purple areas on the map now are areas in the Atlanta region where 60% or more of the population are communities of color and 40% or more of people under 5 are living in poverty. And then you're able to put a third variable in as well. Just zoom in a little bit here. So we can, to further hone in on young children at risk, we can look at areas with a high concentration of children under 5 with disabilities. And you'll find that under demographics. Again, there are multiple age breakdowns available. And we can just set the range here. We'll say we're 10% or more of children under 5 have disabilities. So now you can see that we see far fewer purple areas on the map. So because these are areas that meet all 3 of these criteria. And now if I click on a purple area, I'll be able to see the value for each of the 3 criteria that I set. So in this particular census tract, around 90% of the population is not white, 43% of the people under 5 live in poverty, and 12% of people under 5 have a disability. So now that we've identified some areas of focus in the Atlanta area, the next step for the Equity Task Force might be thinking about community resources and where there might be gaps in existing resources. So we could add Head Start centers to the map if we go to education. We can see now where existing Head Start centers are. We could color code those if we want to see which ones offer early Head Start for the younger crowd. And now we can see that in the purple areas we've identified, there doesn't seem to be much availability of early Head Start. We can also add other potential resources and partners, such as community health centers, schools, nonprofits serving youth, or any of the other community asset data that we have in PolicyMap. So I'll show here, for example, we're looking at community health centers, all these orange squares on the map. We can see where those are located. We could also add schools, filter out those that are elementary schools, since we're thinking about the younger crowd here. And now we're able to see, get a clear picture of where some of the existing resources are and where they are not, and potentially some partners that the Equity Task Force might want to consider working with. So that's the second scenario. We're going to go back now to the presentation to look at what the third one is. So as a third scenario, we'll look at the intersection of health and housing. So in this example, let's suppose that you're a health system or hospital in the Sacramento area that is seeking to assess the need for investments, as well as identify potential partners in upstream social determinants of health, such as housing. So we'll go back here to PolicyMap. Again, I'll just go ahead and remove what we were just looking at. And go back to the maps page. So we'll start here by zooming to Sacramento, California. And now in order to find the hospital that I'm interested in, I'll add the hospital data to the map. Oops. And now I can just search for the hospital that I'm interested in here. So it takes me right there. Here it's a short-term hospital in Sacramento called Sutter Medical Center. And then now that we're looking at the hospital, in order to get a sense of housing needs in that area, you'll see that we have a housing menu here. This offers quite a wide range of possibilities in terms of examining the housing market and any potential concerns in the area around the hospital. So when I click on housing, you'll see we have data around home sales. You can see how housing prices are changing, home values, median rent. We have the residential vacancy, data around home ownership and rentership, subsidized households, and here's cost burdens. So if, say, for example, we know that a lot of hospital employees are renters in the area, we might want to pay special attention to renter housing concerns. So we can take a look at where renters are cost burdened, or where basically that means where they're spending more than 30% of their income on housing. So here, the darker areas are areas where a higher percent of renters are spending more than 30% of their income on housing. So we can see a very dark block group south of the hospital here. When I click on it, I can see that in this particular block group, around 63% of renters are cost burdened, so it's very high. So this might be a potential area of concern or area of focus for the hospital. And then you might want to be able to get a sense of the availability of rental housing in the area. So we can do that by adding some more housing data to the map to get a sense of, say, for example, where all the current subsidized housing is located. Let's zoom in a little bit and add HUD public housing locations to the map. And I will go ahead and add HUD multifamily properties to the map as well. And then I'll add the low-income housing tax credit locations. So now I can see where, in relation to the hospital, the existing subsidized housing locations are. In order to do some more kind of analysis, I'll create a custom region or target area within a certain radius of the hospital, just so we're able to kind of get a sense of which area around the hospital we're really trying to analyze. So I'll go ahead and go down here to custom regions again, create a custom region, a radius region. And so let's say we want to look at within 3/4 of a mile of the hospital. We want that to be our area of analysis. So I'll create that radius region. We'll call the Sutter Medical Center community here. So this gives us a sense of which kind of boundary we're most interested in. So then now we could do what we did before, click on the icon, and this would let us query a list of all of the current subsidized housing that exists in the area. If we wanted to be able to get a downloadable list of HUD public housing or the multifamily properties that are currently in the area, we could do that. But it also gives us a sense of just where geographically these assets are located. And you can see that in this area that we had already identified with a high percent of cost burden renters, we're not seeing any of those locations. So this might be an area that we want to consider focusing on. So as a potential next step, since most hospitals are not in the business of developing housing, a next logical step might be to identify potential partners to work with on this, or to get a sense of whether there's current developments already in the works in this area. So we can do that. I'll get rid of the housing locations for a moment. And now we could start thinking from a lens of identifying partners. So we could maybe want to add the certified CDFI locations to the map, so we can get a sense of any existing CDFIs or community development financial institutions that might be in our area that we could potentially partner with, whether for financing or for development. So we can see here that we have Opening Doors Inc., which is a loan fund, and we get some contact information, the website for the CDFI. We might also want to look at housing-related nonprofits, which we can do as well under quality of life. We can add nonprofit locations. You'll see there's quite a few everywhere, but we can filter out the ones that are related to housing. So here there's a housing and shelter option. So now when I select those, I can see housing and shelter related nonprofits. In this, again, if I click on one, I'll be able to see more information about that. And so now we've gotten a start to identifying some of the potential partners that we should probably be in contact with about our housing related efforts in this area. And again, if you click on here, we'd be able to download lists of those types of assets. So that wraps up the third example. Before we're close to, we've gotten some good questions coming in, and before we get to those, I just want to show one more quick example, and then we'll open the floor up to questions here. So as a fourth and brief final example, we're going to look at an example around community engagement. And so this scenario is one we get questions about a lot, which is from health agencies that would like a public-facing mapping tool to help with communicating information with the public. So in this case, we'll look at a state health system, such as in Hawaii, that's been tasked with providing a public-facing mapping tool connecting food access to the built environment. So for this example, instead of going to PolicyMap, we'll go right to the public-facing tool that we created for them. So this is a public tool that is a mix of community characteristics data from PolicyMap, as well as local state-provided community assets data, such as transportation, homeless shelters, food banks, food pantries, et cetera, which was provided by the Department of Health in Hawaii. And you can see this tool has been embedded in their site. They have some contextual information below it, and then also some additional kind of program information and overview related information below. And so the map is really helping to supplement all the messaging going on the website. So I'll just zoom in to Honolulu, a place we all probably wish that we were this afternoon. But now when I click on New Map, you'll be able to add and change data to the map. So you can see when I click on transportation, there's a lot of different transportation options that they provided. You can see they selected certain health-related indicators here. We also created custom poverty cut points that reflect the SNAP eligibility guidelines in the state. So they wanted these different poverty thresholds. So now if I zoom in, as you can see, this is the estimated percent of families at less than 185% of poverty, because this is their SNAP eligibility guidelines there. And then we could overlay existing food pantries, existing food banks, and other resources on the map as well. For example, here we can look at food pantries again. So this was data provided by one of their partners at the University of Hawaii. So we can see, just zoom in a little, where the food pantries are located. And in the legend, if we wanted to be able to switch from percent of families to a number, so we can actually get a sense of how many families below the at less than 185% of poverty live in the area, we can click to number, and then we can click on an area and see the specific number of families at that poverty level. And we'll also see which pantries are currently available to them. So this is helpful for their planning purposes and also as a way of communicating this information to the public. You're also able, just to give you a sense of some of the other data that they chose to provide, as I mentioned, you can put some of the transportation layers that are local to the islands on, and they selected some other data as well, like homeless shelters they provided, so they wanted schools, that type of thing. So this is an example of how we can merge, PolicyMap data with some local data in a public-facing tool, if that's of interest to anyone. So now that's concludes the health equity case studies that we're planning to walk through today. So now we'll just go back to the presentation and just going to take a look at the questions that have come in. And again, I encourage you all, if you have any questions, please type them into the control panel and we'll either answer them now if we're able to get to them, or we will reply by email to you. So I'm just taking a look at the questions. So here's one from Ramya. For those different measures on access to healthy food, is there a description of what each variable is measuring? So I'm going to just let Eliza answer this one.
Thanks, Kristen. Yes, so for the different indicators that are available through the limited supermarket access analysis, if you click on any of the layers and load them onto PolicyMap, you'll be able to get to the data directory and to also access the description data that is going to be available at the top of the map that will describe what each indicator is showing, and also the methodology that the reinvestment fund used to arrive at those indicators. Thank you.
Great, thank you. So we have a kind of general question here about data. So how do you find or evaluate new data sets to be added? And what's the best way for me to make suggestions if there are others that I think you should add that would be helpful?
Thanks. So I'll take that one again. So when we're considering what new data sets to add, we take feedback from our users and our clients. We try to think about what use cases they might have that that the new data sets might speak to. We also try to just keep an eye out for what new data sets become available. So we have a lot of our staff have interests in and experience in urban planning, public health, healthy foods, many of the subject areas that we cover in PolicyMap. And so we try to keep abreast of new data work that's going on in the field. And then we do always take suggestions from clients. We take those suggestions seriously to try to think about national data sets that will be of use to the most people, that work really well together to help clients create sort of policy intervention solutions. Thank you.
Great, and we have another data question here, so I'll just let Eliza continue to roll with this. So what is the data source NCSS for the not-for-profits, and how frequently is it updated?
Okay, so that's the National Center for Charitable Statistics, NCCS, at the Urban Institute. So that is a center within the Urban Institute, and we update that data annually. Currently, it is available up through 2015, and that data is released, I believe, in the summer, and we update it once a year.
Great, thank you, Eliza. So this is a display question. There's one about, are you able to customize symbols when you're putting facilities on the map? So for example, could you put an H symbol for a hospital? And I can just go ahead and answer that. So with the data the data sets that are currently in PolicyMap, we select those, you can't change them on your own. But we also, our data team loads data for users all the time, and in those cases you're able to select the icon that you want, not necessarily an H for a hospital, but we do have a lot of different options available, so it's kind of a two-part answer there. And we have just had another data question come in. So do you have any health or equity related data that isn't available in some of the other competitors' tools? I'll turn that back to Eliza.
Thank you. So, as I mentioned at the beginning, one of the main data sets that groups of indicators that we have that is exclusive to PolicyMap is the small area estimates for health outcomes. So data that we take, and we take the BRFSS survey data and we create small area estimates. So that would be indicators such as rates of diabetes, chronic conditions, things like that. That is a group of indicators that we develop in-house, and that is only available here. Other data that we have that is related to health and equity, we have data from a new data set actually that we just published in December called Consumer Spending Habits. That data can speak to public health equity concerns because we have information on things like estimates on food spending, household spending on food, and other estimates for health spending on housing. So we do have some of those other estimates that are exclusively available through PolicyMap.
And then just this is another more general data question. Just how often is the data updated in the platform? Do you want to take that one as well, Eliza?
Sure. Well, that really depends largely on the specific data set. We keep a detailed calendar for when data releases occur. So you've probably gotten a sense a lot of our data comes from federal sources. Many of the data sets that we have a specific and reliable release schedule, and so we update those when they become available, generally once a year. So, for example, our census data from American Community Survey is released each December, and we update that same month, usually about a week later. Other data sets have a less reliable release schedule, or maybe released occasionally. Let's say if it's say a result of a study, or if it's a smaller agency or a smaller organization, we may update less frequently. Some data sets we have are actually updated quarterly or even monthly in the case of some of our economic data. So it really depends on the release schedule of the ultimate data source. Yes.
Thank you. And here's a question, also data related, documentation related rather. So for example, if I didn't know what CDFI stood for, is there a place on PolicyMap where I could see what that stood for or get an explanation for that? And I really love this question, especially when thinking about the health and housing example. I remember the last health and housing conference I was at, and somebody was pointing out that to some people, CDC means Community Development Corporation. To others who work in health, it generally means the CDC, Center for Disease Control, and the way that you interpret acronyms really depends on what your background is. And since PolicyMap has data across such varying policy areas, this is a really particularly important question. So do you want to answer that one, Eliza?
Sure, Kristen. That is a great question. And as Kristen said, we have a breadth of data, so and a lot of acronyms that we use on PolicyMap. And so, yeah, to answer the question, we are very careful to try to make our documentation accessible for subject matter experts and also people who are experts in other areas that want to do sort of cross-cutting analyses, and also for lay people. So we're very cognizant of that it can become sort of an alphabet soup. So I would say the best case is, if you're exploring data, is to just sort of add it to the map. If you're browsing through and you see something that's interesting and you think, oh, okay, well, I wonder what that's about, add it to the map, and then you'll be able to click on some of the links through the map, and you'll be able to see a data description, so a description for each indicator that you're looking up, and you'll be able to get to that data directory, which provides detailed explanations, and will also direct you to URLs where you can even get to the get to the ultimate data source, and you can read the about sections on the source agencies' websites and things like that. So yes, we also, it's good to point out that we write our data descriptions ourselves. We base them on anything that's already been published by the ultimate, whatever the ultimate data source is. But there are people here in the office right now who write those descriptions ourselves, and so we work very hard to make sure that those explanations are accessible and make sense, so that any person who wants to use these data points in conjunction with one another can figure out how they came to be and can use them appropriately.
Great, thanks, Eliza. So I think we have time for 2 more questions. So I'll turn this next one over to you, and I can answer the last one. So which programs does your team use to create these maps, e.g. GIS, etc.?
That's a great question. So to create, let's see, how do I answer this? To create, well, we have our own, to actually display the maps on the website, we have our own in-house group of developers. Well, they're in LA, so they're nice and warm right now. While we're a little bit chillier here in Philadelphia. So we have a group of developers, web developers, who create the website based on a set of software that we've developed. To process the data to deliver to the developers, we use SQL Server. We occasionally use R. We have a couple of Python scripts here. So we have, our data team is a group of sort of platform agnostic data nerds like myself. We do use ArcGIS on occasion to do data processing, to do geocoding, to get the data into a format that we can pass off to the developers to load onto the PolicyMap website. So there's also, this might be a good time to mention that if you sign up for our blog, that's the word I was looking for. Sign up for our blog. You can see some notifications on some platform redesigns that are coming down the pipeline for us. So you can take a look at PolicyMap, not only how it is now, but what it's going to look like a year from now, where we're going to transition over to a Mapbox-based platform. Thank you.
Okay, so we'll take one last question here, which is, can you tell us again how to embed a map into another website? Is there a script we can use? How do you modify the layers like the Hawaii map? And I can answer that one. So with the embedded map that you saw, the example with Hawaii, that's a public-facing tool that our data team created with the Hawaii Department of Health, where we work with them as they selected which PolicyMap data and which of their own local data they wanted to include in the tool. And then our member from our data team created it for them and basically provides very, very small little bit of code that you can use to easily embed it into your website. And it's essentially providing kind of a window into the platform. In terms of modifying layers, it's really up to you or the client to decide which layers you want to be able to include, and then also which, if you want the data you're providing to be downloadable by the public, that type of thing, and any modifications to it that you want available. And if anyone's interested in talking more about that, then you're welcome to contact me, and my email will be at the end of this end of the presentation here. And so I think that's about all we have time for in terms of questions. Before, just as a last kind of final note, I'd mentioned in the beginning of the session that we're happy to provide free trials to anyone who's not familiar with PolicyMap. We can provide one for your organization, so you have time to explore it on your own. And we're also providing a special discount for attendees of the webinar who are interested in purchasing a subscription potentially in February. And again, the details for this will be sent out in an email, but essentially depending on which type of access that you want, we're providing some additional free months as well. So just bringing down the charge for you. All of the subscriptions are pretty affordable to begin with, but we wanted to be able to provide an additional discount for health-related subscribers. So if you're interested in that, feel free to respond to reach out to me at the email here, or you can reach out to all of us at info@policymap.com, or you can reply to the follow-up email that you'll receive in the next few days. So thank you very much for joining us today. It's been a pleasure, and we look forward to being in touch with some of you, and I hope you all have a fantastic afternoon. Bye-bye.